If you're noticing that breathing getting very rapid, the person sounding agitated, looking tense, maybe they're making fists, looking like it's hard to hold still, then you point that out and you say, do you notice that? And could we just take a minute and let's stop talking about what we were discussing and instead just take a minute. And if you could, look around the room and describe it. This is where clinicians often know the skill. Describe 3 things in full detail. And so as they begin to describe what it is they see in your office, and I often add, because they're feeling at some level threat, I'll say, what are 3 things that you like to look at in my office? And so they go to those things, that becomes their anchor. Again and again, we use those things. And so with my client, I'll know, look at the cat figurine. Can you describe that one? Or whatever. One of my patients loves a plant in my office. Look at the crazy hair plant. Can you describe that? So we're connecting back to our relationship and the present moment. And as they're doing that, the sympathetic nervous system is starting to calm down because they're able to start breathing better, more normally. If I'm not seeing their breathing get re-regulated, then I may also point that out. After they've described some items in the office in detail, then I might say, it's looking like it's that your breathing is still fast. You notice that. How about we work on breathing together? And just if we can, letting our breath out slowly. That exhalation is really important to activating the parasympathetic nervous system. And then I'll keep checking back in with them from time to time. Are you feeling more present now? Are you back here in the office with me? And for clients who are okay with the technique of just asking, where are you from 0 to 10? It's a very cognitive technique, but I'm trying to help them learn to tell where along the level of dissociation are they, or hyperarousal. And so I might ask, how grounded do you feel right now? If 10 is very grounded, very present, that's what, we're looking to be somewhere in that upper range. And so when they can tell me they're there, then we go on back to, if we can, whatever we were talking about. If I'm noticing that they're starting to look more frozen, so their breathing often begins to slow down. The breathing may continue rapidly, but they're frozen. So I'm going to try and imitate it. And I may just point it out that it looks like you're starting to get a little bit still and your breathing's rapid. Do you notice that? Could we work on grounding? When they're starting to go into the beginning state where there's both hyperarousal or sympathetic nervous system and parasympathetic activated at the same time. So the rapid breathing plus a frozen state. I want them to recognize that if they can. And then because they're frozen, that can be very frightening to people who've been traumatized. Not being able to move can be terrifying. And so I'm going to try and help them get to the point where they can move. And so I'll say, it's looking like you're frozen or holding very still. Would it be okay just to move just a little bit? Maybe you could push your feet into the floor. And I'm watching for that tension. If that muscle tension, if I see there's the beginning of a movement, I'll just keep going with that. But if I see no indication of movement, then it probably means that they're more frozen or into that tonic immobility state and maybe going into collapse. Although with collapse, you begin to see exactly what the name says. You often begin to see the person pulling inward, getting small, something like that. But going back to the tonic immobility, I'm trying to get a little muscle movement. If I don't see any indication their feet are pressing into the floor, I might say it looks like I'm not noticing that. I wonder if you might move in a way that's so small nobody could see it. The reason why that can be helpful for some people is because they learned to hold very still as a survival mechanism, and they didn't want people to notice them. They wanted to be small and hidden as best they could and take up little space often. And so if you add that little statement that nobody could see, then they might be a little bit less afraid. And so I might suggest maybe you could just move a toe or a little pinky finger, something like that. And if you see any movement, then you keep encouraging them to increase that. That's great. See if you can keep moving that even more. Wonderful. You're starting to get yourself unfrozen. That's terrific. And I might just repeat from time to time, you're here with me, who I am, because you're working on orienting. So you're with me, Dr. Brand, you're here in my office. It's May 2020. And I'm just repeating all these kind of grounding, orienting techniques while I'm encouraging movement.